This is Jerome Cambry with VieMed. I'm here today to demonstrate how to perform inverse ratio ventilation using the Trilogy 100. So the easiest way and best way to accomplish that is that we want to go into pressure control mode. Now, in light of recent events, we felt it necessary to make this video because most of your COVID-19 patients will develop ARDS, right? So you've got pneumonias, you've got total consolidation and whiteout, and really, this is the form of ventilation that even if you start an assist control, that you will find yourself winding up in very quickly with these patients. So I'm going to go into the menu, go into our settings, and you'll see we've already got it in pressure control mode, and you can go through and scroll and see once again the different modes that the Trilogy can perform. Your usual volume modes, SIMV, assist control, control ventilation, SIMV with pressure control, but we want to use specifically pressure control ventilation. So our IPAP in this situation is going to be our pressure control that we're using. So we've got that set at 25 currently. We've got our EPAP, which is our PEEP, set at 4. We've got our breath rate set at 11. Now, here's where we need to make our adjustments. To perform inverse ratio ventilation, obviously you need to go up on your I time. So your inspiratory time needs to be adjusted. Normally, when we're talking about someone who has obstructive lung disease, their IDEs will be 1 to 3, 1 to 4, 1 to 5 in extreme cases. This is a patient that has severe oxygenation needs. And so in order to accomplish inverse ratio ventilation, we have to make our I time much higher than you normally would. So changing the setting on your I time also has to be done in conjunction with your breath rate. So you may have to test this and see what you're getting as far as minute volumes are concerned, as well as what your IDE is after we get out of this screen. So I've got it on 11 breaths per minute. And when I do that and I go down to I time, the max I can set is 2.7 seconds. We've got our flow trigger sensitivity set on 1. This can be adjusted as well based off of how the patient is doing, but I'm just going to leave it there for the time being, as well as the rise time. So let's get out of the screen and see what our patient values are currently. So if you notice right here, IDE ratio is 1.1 to 1. So in normal circumstances, someone with normal lungs is going to have a 1 to 2 IDE ratio. So we are moving away from what is considered normal breathing. And again, this is necessary to help oxygenate someone who's having severe oxygenation needs, like diseases when it comes to ARDS, someone who has severe pneumonia, total whiteout, consolidation. So you'll see that we have an active circuit on this particular setup, as seen in previous videos. So currently we're at 1.1 to 1, 1.3. So we're getting some fluctuation. I moved the vent, so I moved the circuit as well. And again, you're really going to have to monitor the patient and see what you're getting as far as your minute volumes. Be aware of your mean pressure at all times. You don't want your mean pressure to be too high. Always treat the patient first, not numbers on a ventilator. And so we have kind of fooled around with this earlier in order to try to get as close to 2-to-1 as we could. So I'm going to take this breath rate down to 10 and go up as far as I can on my eye time, which that will allow me to go to 3 seconds. So you'll see now I have a 1.4 to 1 I to E ratio. And again, I've moved the circuit a little bit, so there's some fluctuation there. But again, at the end of the day, make sure you're treating the patient rather than numbers on a ventilator.